Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Here we are, another episode of Smile Sisters.
Okay.
So I wanted to go over PRP. PRP is an amazing, amazing thing. It's like a magic thing.
Okay, why don't we say, what does that stand for, first of all?
It stands for platelet-rich plasma.
Okay.
It's a component of your blood, of everyone's blood, and we can actually isolate it and use it to help heal wounds and everything.
Mm-hmm. So it's used in many things other than dentistry as well.
It is. There's been tons of studies, and I pulled some up. So I'm going to just read through it.
Okay.
So skin wounds, PRP can reduce inflammation, increase angiogenesis, and speed up reepithelialization.
Okay. So that means basically putting the skin back.
Right. Like it increases the creation of new blood flow and creates new epithelium faster in a wound in the
your
skin.
skin cells that require it to be there. Okay.
Chronic wounds. PRP injections can help wounds heal faster, with some patients showing significant improvement within 3 weeks. So I think this is studies that were done on people with chronic wounds like diabetic wounds and things like that.
That's very cool.
That will help them to heal
So
faster.
why does PRP help in healing?
PRP has plasma in it, which is basically your own blood's healing component. So it's as if you like kind of compress those and put them there.
Right.
So it's
your immune system is fighting
you're
for you.
using your own immune system.
Sure.
Yeah. Okay. Tendon problems. PRP injections can improve outcomes for certain tendon issues, such as tennis elbow. So that's, I don't know why it would help with that really, but these are actual studies that have been done. Knee osteoarthritis. PRP has shown effectiveness in treating mild to moderate knee osteoarthritis. Rotator cuff injuries. PRP injections can help with pain and mobility.
Okay.
And arthritic shoulders. PRP injections can help relieve symptoms. Lower back pain. Early research suggests PRP might be effective in some lower back pain cases.
Okay.
So it's just this amazing thing that our own body makes, but by concentrating it and putting it in a certain area, it really like superpowers the healing of that particular area.
So basically we're talking about pain, swelling, and infection.
Yes.
Whether it's chronic or acute, which is like it's been there for a while, or it's like something new that's occurred.
Right. So it's just helping your own body to heal faster.
That's awesome.
And we use it with surgeries and in particular wisdom teeth extractions. So we actually take it, we concentrate it, and we put it right in after you've had your wisdom teeth taken out.
So you put it in the little hole where the tooth came out of.
That's right. And we have seen in our practice, this is not a research-based study, but we have seen no dry socket, zero.
Yes.
I don't think we've had any dry socket.
That's correct.
Definitely reduced in pain and inflammation. And the thing that I really am excited about it is because it reduces pain and inflammation, it can help reduce the nerve injuries that are sometimes associated with wisdom teeth.
The impacted ones.
Sure. Because the nerve injuries are sometimes related to inflammation in the area compressing that nerve. And if you don't get as much inflammation, then you're more likely to protect that nerve.
Fair enough. So nerve injury can happen sometimes if you have a wisdom tooth that's stuck really deep in your jawbones, usually the lower jaw, where when you take it out, it causes swelling in the area and affects this nerve that we have that runs through here and innervates your lower lip and the side of your tongue and the teeth.
Yes.
And so sometimes it can take many, many months for that nerve to recover after surgery.
Right. And I think by including PRP in the process, you can really minimize that initial inflammation and thereby minimize that compression to that nerve.
So how do we do PRP in our office?
So it's just like going to a doctor's office and getting your blood drawn. So we take blood from your arm and you basically spin it in a centrifuge and that separates it into the layers, and we just take out the plasma layer. That's the one we use. We also use it for other things in dentistry. For example, when we do implants or when we do grafting, like gum grafting to cover root recession or cover sensitivity, we use it for that. I mean, it's pretty much become like a routine part of our practice because
we do it every day.
Yeah, it's so easy to get. It's right there. Everyone has it, and then it helps so much, much better than any kind of like, I don't know, drugs that we could give you for pain and inflammation.
It's become more prevalent in dentistry, but certainly most practices don't do this. But it's a benefit to you. So.
Yes, it is. And I mean, I've come to the point where I won't do some of those surgeries without it because I've seen the results, after doing hundreds and hundreds of surgeries. Why risk it? Why risk nerve injury or infection or dry socket? It's such a simple thing. Like, let's just use it. It's right there. It's so natural. You're not gonna have any response to it. It's not like you're gonna reject it or something.
Yeah, you're not gonna have an allergic reaction.
Right, you're not gonna have an allergic reaction to it, and it's super beneficial.
So we spin the blood and take it, and it forms this kind of glutinous stuff, like a slug, and then you stick it into the socket, into the hole where the tooth was removed.
Right.
You can also compress this and create a membrane, right? And that's when you use it for covering up like a bone.
Implants or bone. But also, you know what it really helps with when it comes to wisdom teeth surgery? It helps you clot faster.
Okay.
Because for healing, you need that blood to clot. And, when you cut yourself, you get a blood clot. And same thing happens in your mouth. We need that blood to clot. And the PRP is like a pre-made blood clot that you're just putting in there. So it's like, boom, it's done. The bleeding just stops. It's pretty quick.
It's like you form that scab that you need in your socket sooner. And that's one of the reasons why it reduces dry socket, because one of the issues with dry socket is that your clot falls out, and then you have this kind of raw tissue, and it's more likely to get infected.
That's right. So the faster you get to that like blood clot healing, everything starting, it's like as if you give your body a jump start on healing. So things just like move along faster. And it's used also, I mean, I told of some medical uses, but it's used a lot for cosmetic procedures as well. I mean, you can go to like a med spa and get PRP injections in your face.
Sure, instead of like a filler.
Right. It can create like new collagen growth.
It promotes collagen growth in your own skin.
Yeah. It really is like a magic substance.
It's in you.
And it's in you. That's what's magic about it.
It is, yeah. It's very cool.
It's already there.
It's not some like tissue you get from somebody else or, bovine, whatever. Like
What's bovine?
It's about cows. So often bone graft is taken where you take the bone, right? And it can come from cows,
yes.
right? Yeah.
It can come from cows or cadavers, and a lot of people aren't comfortable with that.
They do ask about that, right?
Yeah.
So let's talk about bone grafts and PRP. So sometimes you can also mix that blood with the graft, right? And put it in the socket.
Right. So bone grafts, let's talk about different types of bone grafts. So bone grafts can be from bovine cows, or they can be from other people, from cadaver bone, or they can be from yourself. So we can take bone from another part of your mouth and like crush it and put it. And the best one is the one that's from yourself. And okay, here's a really, really cool thing. So back in the day, the gold standard for bone grafting in the mouth was to go to the hip and get bone from the hip. So you had to like go into the hospital, get fully sedated, have 2 surgical sites. So you had your mouth and then you had your hip. And so after your implant surgery or whatever, you were actually like having a hip thing, which is like crazy. So now they've actually compared the bone graft that you get from your hip compared to PRP, and it's the same. So you can actually cut out that whole surgery
And just do
of
PRP.
your freaking hip and going into the into the hospital and having this secondary surgical site by just adding PRP
to the things
the-
that you
to
do
like
when
the-
you have
yeah.
an extraction or
yeah,
an implant.
yeah. So it's just amazing. Like the results are just like mind blowing. So it's just an amazing thing, and it's so easy to get. It's available, and
So
we
don't be
love to
afraid
use
if you
it.
go into a dental practice and they want to draw your blood to do your surgery because they're trying to do PRP.
Right.
So let's talk about what are the top 3 benefits of PRP during surgery.
So, okay, if you're getting extensive implant surgery and you need a lot of bone addition, one of the hugest benefits is no secondary surgical site.
Okay.
So no hip surgery. Or knee, they would go to the knee too, right? Like knee and hip.
So, but compared to not having it, what are the benefits of
Oh,
having
okay.
PRP?
Well, definitely the dry socket has been a huge change
So,
for us.
no infection.
No, yeah, decreased chance of infection, dry socket, decreased inflammation, so you're gonna see less swelling. You're not gonna have as much swelling.
Sure.
Because all those inflammatory things, I mean, inflammation is basically your body bringing blood and bringing all the stuff to the site to help you heal. But we're already putting it there. So your body is like, okay, it's already there. I don't need to bring all that. So you're gonna get less inflammation. And then I think less pain. I'm noticing less pain too.
Yeah.
So a great addition to any wisdom tooth surgery.
Yeah, reduces your pain, infection, and swelling.
Yeah. Yeah. PRP, look it up.
Okay. That's it for today.
Okay. Check us out at LA Dental
Yeah.
if you have any questions.
Bye.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.